Does caffeine interact with blood pressure medication? Have you ever wondered how that morning cup of coffee might affect your blood pressure? Today, we will discuss the relationship between caffeine and blood pressure medications. Caffeine is a natural stimulant found in coffee, tea, and some sodas. It can cause a temporary rise in blood pressure shortly after you consume it. This happens because caffeine stimulates the central nervous system, blocking adenosine receptors that usually help you relax. As a result, caffeine can keep you alert while also raising your blood pressure for several hours. Now, what about blood pressure medications? Most of them do not chemically interact with caffeine. However, the increase in blood pressure caused by caffeine can make it harder to control your blood pressure effectively. This is especially important for those living with hypertension, where stable blood pressure is key to managing the condition. Some blood pressure medications, like beta blockers, work by slowing down your heart rate and reducing the workload on your heart. If you drink caffeine while taking these medications, it may reduce how much of the medication your body absorbs. This could lead to decreased effectiveness, making it more challenging to manage your blood pressure. Caffeine can also interact with other medications that people with hypertension might take. For instance, combining caffeine with stimulants like pseudoephedrine, which is found in some cold medicines, can raise blood pressure and cause jitteriness. Additionally, caffeine can affect how your body metabolizes certain drugs, changing their levels in your system. For those managing hypertension, it is wise to monitor and possibly limit your caffeine intake, especially if your blood pressure is not well controlled or if you are on medications that could be affected by caffeine. Here are some practical tips to consider. First, avoid consuming caffeine right before measuring your blood pressure to ensure an accurate reading. Next, discuss your caffeine consumption with your healthcare provider to understand how it might impact your specific medication plan. If you notice your blood pressure rising or experience side effects, consider reducing your caffeine intake. Lastly, be cautious with over-the-counter medications that contain stimulants, as they can amplify the effects of caffeine. In summary, caffeine can temporarily raise blood pressure and may reduce the absorption of some blood pressure medications. People with hypertension should be mindful of their caffeine intake and consult their healthcare team to maintain optimal blood pressure control.